Today we will be teaching you how to use the SoPro Live camera. Live stands for Light-Induced Fluorescent Evaluator. This camera is an intraoral camera and carries detector. In order to use this camera, first save the blue cloth that comes with the cassette for later and apply the sheath on it by putting the camera in lens facing down. Then turn off the overhead light and set up the camera through the X-ray template in Axiom. To take an image, step on the pedal and the image will appear. Then step on the pedal again to make the image disappear to take another photo. The smallest dot to your left is called the extraoral mode. This mode, also known as the selfie mode, is used to take portraits and profiles of the patients. The next dot over is called the intraoral mode. With this mode, you will take images of smiles, quadrants, and forms, or one tooth. To take a photo of the quadrant or arch forms, place the camera on the opposite arch with the camera facing toward the quadrant you want the picture of. The blue line is known as the carries detection mode. For this, you have to always make sure you have your black cap on, which blocks out ambient light. With the daylight mode, the camera emits a white light that is great for evaluating the tooth. Setting 1 is the diagnostic mode. The diagnostic mode is for diagnosing decay and will shine a blue fluorescent light from the camera in order to penetrate the enamel and excite the dentin to reflect the tooth morphology back. The tooth will appear green-blue, indicating good, healthy enamel, while red or black shows collagen breakdown and/or decay. When you push 2, you will still see the blue fluorescent light, but this is for treatment. You will want to use this mode when you are in an open preparation or working in open decay areas. By using this mode, you can remove the red decayed tissues and do minimal dental invasive treatment. The largest dot is macro mode. This setting will magnify your image, but you will have to put the lens of the camera right on the tooth surface in order to get a clear picture. Make sure to use the air and suction to remove any excess saliva. On the handle of the camera, you will have 2 buttons that you can use in the macro and carries detection mode. Both of the settings will emit a blue fluorescent light, and to return to daylight mode, just push the current setting that you were on. When finished, disconnect camera from the port by gently pulling at the insertion port and be careful not to damage the connector. Then remove the black cap and sheath. The cap is autoclavable and the handle should be wiped down with a cavi wipe. However, you must not wipe the lens, only the handle. The camera should be wrapped back in the blue cloth to be placed in the cassette and returned to the dispensary.